Welcome to the Chemotherapy Clinic at the Woodstock Hospital. Receiving a cancer diagnosis can be one of the most difficult issues you and your family will have to deal with. It can make you fearful, sad, and even angry. It takes time to process your diagnosis and next steps. After seeing a cancer specialist at London Health Sciences Centre, one of your treatment options may be to receive systemic therapy. This can be in the form of chemotherapy or immunotherapy. If you are from Oxford County, this treatment could be closer to home at the Woodstock Hospital. This video will introduce you to our clinic, the staff that will help you, and what you can expect as we support you through this difficult journey. The Chemotherapy Clinic is located on the lower level of the hospital. The hospital has two parking locations, the main entrance, which is on the main level, or the Athlone entrance, which is on the lower level. The Chemotherapy Clinic is located along the L200 wing, so please follow the signage or ask for directions. Our chemotherapy clinic is staffed by a registration clerk, nurses, a physician, a pharmacist, and a volunteer. Our goal is to make your visit comfortable, safe, and answer any questions you may have about your cancer treatment. When you arrive at the chemotherapy clinic, you will be greeted by one of our registration clerks. Their role is to confirm some of your personal information like name, date of birth, and health card number. They will apply an armband, which will be used by other members of the team to confirm who you are for your safety. Then you will be escorted to our kiosk to complete a short health check questionnaire. The health check questionnaire asks you to rate how you're generally feeling and if you're experiencing any specific symptoms like pain or loss of appetite. This kiosk requires that you scan your health card to answer the questions. Your results are added to your electronic health record so that the doctor and nurse can review your responses with you. Your height and weight may also be taken at this time. Next, you will be escorted to your treatment space. Our clinic has a variety of chairs and stretchers. If you have a preference, please tell the registration clerk or nurse, and we will try to accommodate you at future visits. There are also 3 exam rooms, which may be used by the doctor if you're required to have a physical assessment before your treatment. Blood work may be required on the day of your treatment. If it is needed, then either a nurse or a staff member from the lab will draw your blood and get it processed. Before every treatment, you will be asked to review your allergy status and your medication history. At your first treatment visit, a pharmacist will sit with you and review your medications from home. Please bring an accurate list or your actual medication vials for a thorough review. If your medications change in between your treatment visits, let the nurse know so your medication list can be updated in your electronic health record. In most cases, an IV will need to be started in order to deliver your cancer treatment. You may have a central line already in place in your chest, called a port, or in your arm, called a pick. The nurse will need to ensure that the line is clear and working properly. Or the nurse will have to start a separate line in your arm or hand area. The nurses will use a warm blanket ahead of time to bring the blood vessels to the surface of your skin to make it easier. The chemotherapy clinic is equipped with televisions where you can watch your favorite daytime program. There is also complimentary Wi-Fi, so please feel free to bring a device from home and stream a good movie. At the Woodstock Hospital, we have an on-site Tim Hortons on the lower level, so grab a coffee before your visit, or your companion can grab you a treat while you're waiting to start your treatment. You are also welcome to bring snacks and refreshments from home. The clinic has 2 bathrooms available. One is dedicated for patients receiving cancer treatment, and the other can be used by companions or those patients receiving other treatments in the clinic. We also deliver other types of intravenous therapies. There are lots of equipment in the clinic. There are IV pumps that deliver the treatment, vital sign towers that allow the nurses to take your blood pressure, oxygen levels, and temperature throughout your treatment, and computer workstations, either mounted to the wall or on wheels, to help the nurses chart your care during your visit. One of the ways we ensure your safety is by scanning your barcode on your armband and the medications you receive to ensure you receive the right medication at the right time. Our nurses also perform many double checks when programming the pumps before delivering your treatment. We will ask you many times to repeat your name and date of birth. This is how we make sure we have the right person and you're getting the right treatment. Our nurses will wear protective equipment when they are administering cancer treatment to you. This can be in the form of a special blue gown, special gloves, and even a face shield. These protect the nurses from any accidental spills or splashes. Pharmacy prepares your cancer medication specifically for you. However, there may be slight delays as we manage all of the requests. We strive to work quickly and safely to prepare your treatment with a minimal wait time. At the Woodstock Hospital, we have a PharmaSafe pharmacy on site that can fill your prescriptions while you receive your treatment. This pharmacy carries all the specialty medications that may be related to your cancer treatment. If you are interested in using their service, please bring any health insurance with you so they can process your prescriptions.
Teaching you and your support person about cancer treatment is a big part of what we do. On your first treatment, you will receive a lot of information about your treatment regimen and how to manage any side effects. At every visit, the nurse will review how you felt after your previous treatment and will work with our physician to improve your experience. We also have access to your medical oncologist at London and can follow up if more direction is required. Your support person is an important resource to you. At your first visit, we encourage you to bring that person with you so that they can get the same information you do and be another set of ears. However, there may be times when the clinic is not able to accommodate more than one support person due to the limited space around the treatment areas. Therefore, we limit only one companion per patient, but you are free to bring in different companions with you at each of your treatments.
Before you leave, the registration clerk will provide you with any follow-up appointments here at the Woodstock Hospital or perhaps back with your oncologist at London. Do not leave without receiving this important information. The nurses will do a final check with you by removing your IV and answering any final questions you may have before you are free to leave. If you need assistance exiting the building, then we will be happy to call a porter to assist you out by wheelchair. I hope this video has given you an idea of what to expect at the chemotherapy clinic at the Woodstock Hospital and has eased your anxiety slightly. Nothing can really prepare you for this journey, but we try our best to support you and help you navigate the complexities of the next several months. Receiving care within your community and closer to home is one small way we do that. Thank you.